it's time to leave.
Hi, today we are with Einstein Rojas, who I had the pleasure of meeting here at this amazing Global NCD Alliance Forum. Einstein is also on the NCD Voices Advisory Committee. I would love it if you could share a little bit about your journey into activism, the reason why you do this work, but also what do you think is really important about the work that you're doing within the tech space that's disrupting entities as part of the movement towards progress.
Yeah, definitely. So my name is Einstein Rojas. I'm from the Philippines. I'd like to tell my story. When I was in grade school, my father had stage 4 laryngeal cancer. And I was a very young boy back then. I didn't knew what was happening. We're living a good life, but suddenly our life changed. We went into debt when we went into our family and friends to ask for medicines and healthcare support. And now, throughout the years, my father is now a strong advocate. He has his vocal cords removed, and he has sound voice. His voices sound like a robot.
Total champion.
Yeah, totally agree. And we became the voice of the voiceless. So that is a pretty amazing. And I learned that resiliency from him. I was lucky to be part of the Philippine Alliance of Patient Organizations. This is an umbrella organization of over 50 different diseases, from cancer to rare disease to kidney, you name it. We empower them, we capacitate them, and we give them a way for them to lobby for their healthcare needs. Imagine a startup organization doesn't know how to advocate for their needs.
Yeah.
Now talking to the Philippine insurance, the national insurance, to cover their access to medicines. Imagine that. Yeah, now my undergrad is multimedia arts, and I took my master's in science of and innovation and business. Now I totally understand that there's a technology gap happening for the patients, for the industry, for the government, to have a better access and understanding about their data, about their personal health care, and even up to their operational needs.
Of course.
Imagine a startup organization doesn't have much funds, but with the use of technology, AI, they'll be able to accelerate things operationally.
So if you had one area that you would like to ask world leaders and member states to put on the agenda for NCDs and mental health, do you think technology would be part of that?
Definitely. We have seen innovative financing, and this could be one of your solutions. Tech, innovation, investment is one gap that we are looking into.
Yeah. So thank you so much, Einstein.